So, hello everybody, I'm Jessamine Baird. I work for Sanofi, which is a medicines and vaccines company globally, and I'm the country lead here in the UK and represent the UK and Ireland. So I'm really pleased to see everybody here tonight, which is the launch of our What If campaign. And as a company, Sanofi, as you can see from the statements at the side, everything we do is around chasing the miracles of science and finding a way to improve the health of people and patients with conditions. So on that basis, we feel that this is a really essential, critical time for sectors such as the life science sector to work together with other policymakers, with the health system, with the political system, right across the board in partnership with academics and scientific institutes to ensure that the UK remains a strong and vibrant life science country, but also UK remains ahead in terms of just all of the elements that you would want as people who live here and are supported by our health systems and social care systems. So the what if, we were discussing it before, is the what if is a campaign. We've run it internally to inspire our teams and ask really challenging questions, because what we want to do is make sure we are asking the questions and making the challenging conversations in dialogue, in partnership, so that we can create an external debate. And I don't think there could be a more important time for this country than we are in now, in this post-COVID environment. And I have esteemed guests. We will be talking about that period of our experience as a country. But I don't think on the global stage, working for a global organisation, it could be a more important time for us to move forward on these agenda, to move our policy forward and to have some really strong discussions about how we can make improvements that will make a difference to people with conditions and our populations. So I'm going to be welcoming, I'm going to have to ask if it's Sir Jonathan Van Tam, or if I am allowed to say JVT, I'll seek permission. And we're at a fireside chat, which is not very green, but there you are, it's a fake fireside. We will be talking about some of these discussions, and I think one of the elements that also we want to bring forward in What If is how we can increase the voices of people, their loved ones and their carers who have conditions which affect their lives. And I think everybody in COVID, it was very clear that there was greater health inequity that was exposed. There were bigger differences than we thought there were in our country. And I think as a company, we're passionate about diversity, inclusiveness and equity. And we're encouraging and working with patients and patient organisations and carers and loved ones to create poetry. And one of those, the reason behind that is that will give people a voice and bring to the fore things that are not talked about enough. So I'll be joined on stage and then subsequently by a panel. So delighted to welcome Sir Jonathan Van Tam to the stage, and subsequently Baroness Nicola Blackwood, who's Chair of Genomics England, will join us. Sarah Wilnuff, who's the Chief Executive of Asthma and Lung UK, and also Paul Blakely, who is here from the Tony Blair Institute for Global Change. And Sir Jonathan, as you are, I'm sure, aware, was Deputy Chief Medical Officer to the Department of Health and Social Care, so has ample experience, and we're going to have a conversation on those experiences now. So thank you and welcome to this evening. So I think the first question is, can I call you JVT, or do you prefer Sir Jonathan Van Tam?
No, people think that the kind of term JVT was first used at the podium at number 10, but actually I've been trying to make it a global brand since 2007, and actually had my email address at the university changed in 2007 to reflect that. So it was really just kind of living the dream when it happened at number 10.
Well, excellent. You've got more of a fighting chance with my brain of me absolutely not forgetting. So JVT, perfect. So I think, as I mentioned, this conversation is all about asking some of the questions. And we were chatting earlier, but I think given your experience, obviously you started in 2017 before, but the experience that we'll know you and seen you in so much was the experience during the pandemic. I suppose one of our goals would be to capture some of the amazing value that we saw in the intersect between and the partnership that was shown in the pandemic. And I wanted to ask you, what were your thoughts and experiences that you would love to bring forward from that time?
Well, I mean, if we want to kind of delve into the very heart of it, I think because it was a national crisis, because it was an international crisis, and it was so very urgent because of the death toll that was, accumulating day by day, people actually, in all parts of the ecosystem, went into a different kind of mode, and they said, this is really urgent. This is not a time to tolerate normality and the way we've always done it. And they kind of broke norms and they broke rules to make things happen faster. And I think the thing that came out most of all was that it was relentless, and that there was a kind of common mission focus that was relentless the whole way through. So that's the kind of the big headline, and I think what changed. There's a lot beneath that, but I'll stop there and let you ask me some more.
No, and I think maybe that's a point from that is, what if we still had that same sense of mission and could get around it? I mean, in terms of what were the key challenges, and did they change with that? So what were the key challenges before the pandemic, and how did they evolve so that now in a post-pandemic environment, do you feel they're the same? Do you feel that they've evolved as a result of, or do you feel as though we've gone back to where we were before?
So there clearly were some key challenges in the public health space that were emerging before the pandemic, in terms of the increasing prevalence of chronic disease, already the kind of aging population, the likelihood that more of us will live with chronic diseases for more of our lives for longer in the future. All of that was bubbling to the surface, but then the pandemic, in a way, and rightly in a way, kind of killed that conversation, and we had to focus on just stopping people dying and getting ourselves out of this very difficult place that we were all in around the world, including the UK. And in the process of doing that, then I think I would say that having come out the other side, we've learnt things about urgency, about collaboration, about not having these rigid boundaries between the state and the private sector, that we now need to take back into those nascent conversations that frankly are just building even faster now and are going to build even faster in the future because of the geopolitics, because of the economic legacy of the pandemic and where we are now. So in a sense, the kind of mission is to now pick up those old agenda items, realise that they are even more important than they were before, but apply some of those new techniques, new ways of working across the different bits of our ecosystem that I think I'm not going to say have learned, I'm going to say I think we are capable of learning. But right now it's a really pivotal moment in terms of whether we go back to, same old thing, same old results in a whole load of ways, or whether we're actually going to hang on to what we've learnt and say we're going to do things differently from now on.
So that was actually one of the questions, was the key learnings, because when you look at this globally, within the pandemic, everyone was incredibly proud to be part of the UK and the way it pulled together and delivered that science back to the population.
Yeah.
But since then, if you look at all of the comparable countries in terms of how they've recovered, those pressures that were there before, the pressures around bed capacity, ICU capacity, around doctors' capacity, nurses,
yes,
and as those remain and in a way were exacerbated by an efficient system, then became essentially under, overcapacity. So do you think there have been key learnings on how we can maintain the health of our population when we're seeing the outcomes now really low in terms of a comparison to other similar countries?
Yes, so I very much hear what you are saying, and I think the way I approach it is, I suppose, quite holistic, and I'm not going to pull any punches. I'm just going to say it. Faced with an ageing population, a population that are going to need increasing amounts of healthcare as time goes by, we had just run this system too thin, probably in the decade before. And I think it's at least a decade-long problem. It's just been run too thin. We then, not through anyone's fault, put the system under enormous pressure, and the people in it under enormous pressure as well, for a long period of time. And now, in some ways, I feel that our healthcare system doesn't really deliver all that well for people. And I've heard the headlines from the various think tank reports, and including the Tony Blair Institute, and I've heard some of the former Prime Minister's remarks in that space. And fundamentally, I think he's right. I think when you get a contact with the NHS, by and large, it's very positive and very good. But right now, it's difficult to contact the population at their immediate point of need, and it's really not getting to people in time, all of the time. And we have a serious discussion ahead of us about what we want our healthcare system to be in the future, how we want to fund it, and potentially what it can no longer fund versus what it absolutely should provide in a better way. So I do think we're again at a crossroads where some really difficult conversations and deep thinking is going to need to be done. And I don't have the solutions to this, but I am now prepared to say I think there needs to be some thinking in that space.
I mean, were you obviously part of the vaccines task force, and
yeah.
Looking at it from the and I've read the book as well, but looking at it from the outside, obviously shut in our houses and watching the TV, it did seem to me there was it was, as you said, a very powerful mission, but around prevention of ill health, and there was complete commitment to that. And I suppose the question now would be, can you still feel that commitment to that area, given it's an area of your passion? And what would you say were the learnings for that vaccines task force that you could take back out in terms of other areas?
So the thing about the vaccine task force, and I'm very proud of what happened in the vaccine task force, was that first of all, it had complete political support from the very top. And there was, again, complete acceptance that to get to where we needed to go, we were going to have to take substantial risks with public money, because the typical attrition rate of developmental vaccines is at least 90%, possibly higher. And so we were going to have to take significant risks in terms of backing multiple platforms. And of course, that's what we did, 4 major platforms. And all 4 of them now have delivered licensed vaccines around the world. They're not all deployed in the UK. That's not really the relevant point. The point is they all actually scored in the end in terms of delivering a licensed product. But it might not have been that way. We were very lucky. We also took a very bold step in asking initially a venture capitalist to lead the vaccine task force, somebody who thoroughly understood the relationship between investment and outcome in terms of developing products, and somebody who could articulate that. And Dame Kate, was exactly the right person at the right time. And it was relentless. There was a complete non-tolerance of business as usual and business as usual speeds in any part of the system, the industry and in the civil service. There was complete rejection of normal speed. And there was complete acceptance that failure was actually a marker of trying really hard to get there really fast, and that failure in the right way was kind of legitimised, and that was important too. And the kind of psychological contract between the people in the vaccine task force and their work, I've never seen anything like it. I've never experienced anything like it. So clearly you can't run at that kind of pace in every part of the system forever and a day. Otherwise you just burn people out, And I don't mind telling you that I was, absolutely chin-strapped at the end of that stint. But you can think a bit more about what pace you're prepared to accept in terms of medicines, and particularly medicines where there's a crying patient need that is not yet fulfilled. And you have to ask yourself whether whether there needs to be more of a mission to remind people that that pace, particularly for the patients who are waiting for this, must be relentless. That is not an argument for spending money on things that are not good value. That is not an argument for that at all. And we all have to understand that nobody works in a resource, infinite resource system. There will always be constraints. But that doesn't mean that the kind of psychological contract shouldn't be absolutely relentless to try and find breakthrough medicines for difficult diseases and for ones where there's a high population burden.
And certainly I think that's been reflected in the concept of the missions, and it's in the life science vision. I suppose the question is, were there learnings from the vaccine task force that could be taken forward? And do you feel those learnings you're talking about the early science space, you're talking about the industrial capacity. Do you think those learnings have been taken forward and are being carried forward from that time? And how do you see...
I think they're beginning to be, but I think it's just too early after the pandemic to say if they are being taken forwards across the board. But I don't think it began during the pandemic. Thankfully, I think that kind of mindset has moved on. There were lots of conversations between the vaccine companies, the vaccine developers, and governments, not just the UK government, in terms of what we wanted from vaccines, what we needed to see. And that kind of collaborative conversation that was open about what each side wanted was much more in the room in 2020 than it was in decades gone by. And that is better. And that kind of spirit of having an open, collaborative conversation at an early stage, and I do mean at an early stage, is going to mean that companies can manage their development programs through phase 1, 2, 3 much more effectively with a kind of what the customer wants in mind versus what we can achieve, and governments and public health agencies and regulatory bodies can have a chance to think about what they want and say what they want much earlier and anticipate in return how they will use when something crosses the finish line. And I don't think that was there before the pandemic. I think the vaccine task force really made people think about that. It was a national emergency. We were working very hard across government on how we were going to deploy vaccines before we were confident that they would cross the regulatory threshold, which was completely separate, of course. But that was the kind of the pace and the integrated thinking that was there. And I'd like to see more of that, really. I'd like to see more open conversations.
I think what really you're referring to across that whole ecosystem, you've got the funding models, you had a venture capitalist advising, but the whole system of the early discovery in phase 1, but you also had then the trials as they went and were implemented in the NHS. And you had the whole ecosystem in terms of the political organisations, NHS England, DH, and the whole join-up between academia and life science sector. I suppose looking at the life science sector now, UK within the global context, what are your thoughts in terms of where do you think the future is going? Can we capture that again moving forward?
Well, look,
And the regulatory system obviously is
Yeah.
a critical part of that.
The regulatory system must remain independent. There's no question about that. But in terms of our, centralised, fairly standardised healthcare system in terms of the NHS, if you think about what the NHS delivered in terms of research during the pandemic compared to other countries, it was absolutely seismic. It was seismic in many ways. First of all, the NHS waited for evidence. It didn't clutch at straws, and it didn't use novel treatments. We could mention a few that were kind of used as trends in other countries without really any evidence. But the UK held its nerve, the NHS held its nerve, and we waited until we got really solid evidence, for example, from the recovery trial. And because we mobilised the whole of the healthcare system, or almost all of the healthcare system, to participate in recovery, and it was more likely, if you were admitted during the pandemic, to be asked to take part in recovery than not. The recruitment was, astonishingly fast, and in spite of the kind of daunting power calculations that were out there, within 6 months, we had given the UK, we had punched well above our weight. If there's a kind of concerted attempt to mobilise the power of research in this country. So I think there's a lot of potential there. We've just got to be really careful in the next few years about making sure that we don't just kind of get back into business as usual, the old norms of pre-pandemic, and we don't kind of try and catalogue what's changed and try and kind of build it in as a kind of permanent good changes for the way we go forwards in this kind of what should be seen as a kind of a joint pathway between UK Life Sciences and the health service.
And certainly that's what we want, and I think we'll probably be closing in a minute, but I think there was a lot to be proud of at that time, and obviously you yourself being intimately involved in that. I think one of the reasons the timing is so critical is what has been observed in the UK is a slide in the level of trial activity and
in terms of
trial activity down substantially, but also patient recruitment and ability. And I think you referenced the pressure on the health system in this post environment has actually limited our ability to stay as that global leader in that space. So do you have thoughts about how we address those kind of challenges together? Because obviously we would be committed. We've all seen the O'Shaughnessy review. We have the data in the country. We have this amazing capability. So it's very, anyone working in the UK, it's a tough time for us to suddenly see this.
Look, everyone's tired.
Yes.
The public are tired. The health service is tired. A lot of leaders are tired. We need to find inspirational leaders who are going to kind of pick us up again and move us into the next set of conversations around how we get this kind of mojo back. But part of it, it's back to my earlier comments that, the NHS has got to change in some way. It can't do what it's always done. There'll have to be some really radical thinking about this now.
Well, I think on that note, which is, I couldn't agree more. I think it is such a critical time, and it's so insightful listening to you. And I know that some of these topics on some of the challenges we're facing, but also some of the great things that we can build on, are critical as we move forward.